funding spent?
We did.
Good. We did
We
too.
got one of our groups that returned some money, but then we were able to find a different, kind of put it into a city operations a little bit there at the end. So
Good.
Hi, everyone. Good morning. We'll give folks a couple minutes. All right. Well, it looks like most of us are on here, and everyone can continue to join. Don't want to delay us too much because I know we didn't meet last week. So hope everyone is starting off a great new year and had a great holiday. Want to make sure that we have time to get everything in and give folks plenty of time for questions. I know Dr. Velasquez will have to step off this call at 8:55 for another call. So want to make sure if there are questions for him, we can get to those. So on the agenda today, I did not receive any additional items for discussion beyond kind of our typical going through the dashboards, the health officer update, general response updates, an update from GSI, and then I can update you on conversations with the hospital systems that we've been having. So did anyone have anything else they want to make sure we add in to discuss? Mayor Wick.
yeah, just wondering about an update on the vaccine rollout and phases and kind of where we're at.
Yep, Lindia will cover that in her report, and I also, that's actually a good segue because I know Scott Simmons with Spokane, the city of Spokane had requested data on the vaccines be added into our report, and we're kind of working internally and with the state to figure out the best way to report some of the stuff. If you saw our press release a few days ago, there have been some reporting issues with the state. So, and when it comes to the vaccine, and I'm sure Lindia can go into this, but it's going out in different ways. Like the FQHCs are receiving it in one way, the hospitals are receiving it in another. And so we're just trying to figure out the best way to kind of pull all that information to be able to report it out to you. So absolutely, we'll talk vaccines. So I will go ahead and queue up Steve to start talking through data for us.
All right. Good morning, everybody. As Amelia said, there was a large backlog from the Department of Health over the January 1st holiday. It was about And I don't know exactly how many cases were impacted, but this backlog of data reporting for positive and negative cases went back to about December 2nd. So some of the numbers that you'll see are impacted by that. Also to note that some of the numbers reported today will be impacted by Christmas Eve, Christmas, New Year's holidays. So for the previous week, we reported 1,988 cases. That's a slight increase from the week prior to that, putting the daily average at about 284. It was 242 the prior week. Again, it should be noted that we had one day, I believe it was January 1st, where we had well over 600 cases. A lot of that was impacted by that data dump. Also a solid reminder that the daily case counts that we release are based on days reported to us. We get those from hospitals, we get those from Department of Health. So those are not the days that individuals got sick or reported feeling ill, but those are the days that we get the confirmed laboratory report back to us. Of those cases, the prior week, 1,915 were confirmed, 66 were probable for the antigen test. It's a slight increase. Our 2-week total was at about 4,781, which is just, again, a slight increase from 4,589. It feels relatively leveled off. The prior 2-week was 4,699. So for age groups, 0 to 9, still at just 3%. Our really highest impacts are consistently the 20 to 29-year-olds at 19%, the 30 to 39-year-olds at 22%, and the 40 to 49-year-olds at 15%. Continuing the trend of working age adults. Our rate has gone down fairly significantly, but still very high from around 900 per 2 weeks. But currently, our rate per 100,000 newly diagnosed cases is at 714. It was 710 the last week, so that's pretty flat. The non-adjusted rate, so just those that are confirmed cases, not the antigen test, was 677. It was 674 the prior week. Again, relatively flat. For hospitalizations, if you follow the dashboards, you may have noticed there was kind of a lag error in our currently hospitalized that has been corrected. We are currently more accurate on Spokane County residents being hospitalized, but we had 47 new Spokane County resident hospitalizations between December 27th and January 2nd. There were 73 the previous week. Currently hospitalized, and this is Spokane County residents and others, is 121, 112 of which we can confirm are Spokane County residents. Unfortunately, we did have 11 new deaths last week. 2 individuals in their 60s, 2 in their 70s, 2 in their 80s, and 5 over the age of 90. That is a decrease from the 22 deaths the prior week. Testing numbers were greatly impacted by the holiday. The total test for the December 20th through 26th was 6,148. That's down by almost 1,500 from the prior week. That was impacted greatly by Christmas and Christmas Eve, which saw just around 100 tests being taken that day. People apparently were not in the mood to go get tested on Christmas and Christmas Eve. And our average number is at about 878. I would say it's probably more likely going to bump back up to the 1,100 daily average. Our test positive went up slightly to 20.7%. It's a slight increase from 18.6%. I think that's probably about leveled off as well. For healthcare system readiness, as of yesterday, the number of staff beds available is 1,115. Licensed beds is 1,501. Our occupied census for staff beds is about 80%. For licensed beds, it's about 60%. The total COVID census for staffed beds is about 13%, and licensed beds is about 10%. There are currently 8 surge overflow beds in use. For case and contact metrics, our staff investigated 833 cases last week. That's a slight increase, and we reached just about 58% of them within 24 hours. Our care coordination team continues to work with households or individuals in need. To date, they have worked with 1,484 households. There are currently 247 open cases. They closed 73 last week. The service trends remain about the same. Food, PPE, and cleaning supplies and medical are the top 3 needs. As of yesterday at 3:30 p.m., our isolation facility, our hotel facility, we had 15 individuals there, which is about 38% occupancy. But the Immaculate Retreat census was about 34, which is closer to 85%, although they are increasing their capacity a little bit. Our business technical advisors continue to work with businesses in the community. To date, they have done 4,895 consultations. Between December 28th and January 3rd, they completed 174, and they have done 4,545 total referrals. Food security, we did get a slight update, which puts us closer. It's been backlogged a few weeks. It was relatively low for new DSHS EBT applications between December 21st and 25th at 298. That's about the lowest we've seen it in the pandemic. That may have an impact from the holiday as well. For unemployment insurance claims, it stayed level between December 20th and 26th at 1,306 new claims. The industries most impacted, again, are food services and drinking places, administrative support services, and specialty trade contractors. And then finally, for protecting high-risk populations, the outbreaks in long-term care facilities. To date, there have been 77 reported outbreaks. There are 47 that are considered active status, which is an increase of 6 new facilities over the past week. And that concludes my report.
All right, questions for Steve? Okay, not seeing questions.
Commissioner, do you have a question? Sorry.
Oh, sorry. Go ahead, Commissioner Cuny.
So, I don't know, the screen went to a different screen. I couldn't figure out how to get back to this. So on those numbers, Steve, so when as those numbers get updated, do you update the website so it reflects the right numbers? So that way the people that are tracking the per 100,000, that gets updated with that. So we'll see some of those 600 numbers come down and spread amongst other days.
The 600 numbers, no, because that's based on the reporting of the day. But the other numbers are reflected, particularly those that are confirmed and probable. It is the practice with most long-term care facilities that when they do the antigen test, if that's a positive, they go back and then do the PCR molecular test. If that turns out to be a confirmed probable, that will switch within those brackets. Also, our hospitalizations and deaths, those are a continuous moving target based on what the EMR lookups are and the death data that we get reported to us.
Okay, so the bigger numbers, even though we know that that's an accumulation of other days, those won't get changed.
No, because we base our case counts on report dates, and so those are the dates that they were reported to us.
Okay, and so then that's the issue through the state that we need to figure out how to get that corrected. Okay, thank you.
Other questions for Steve? All right. I'm not seeing anyone wave at me or put anything in the chat. So, Dr. Velasquez, do you want to provide some updates, please?
So good morning, everybody, and Happy New Year to those of you that I have not seen yet, although I see a lot of people on the screen that we've already had at least 3 Zooms. But there are 3 areas that I would like to provide some updates. One is in the area of testing. Second is the area of education. And then the third one is a couple of projects that we are working to evaluate here at the agency that I think will be impactful going forward. So the first one is on the testing. You may recall we set up this testing task force about 3 weeks ago. This will be the 3rd week of that task force. We have about 123 members representing about 35 community organizations, as well as healthcare providers, diagnostic providers, higher education, and a number of other entities. So I think we have brought to the table constituents from all areas of the community, which was one of the goals, to bring everybody to a single conversation about a community-based testing strategy, as opposed to half a dozen different conversations around town. So last week on the 31st, we launched the first 6 work groups, which will meet on Thursday at 11. And these 6 groups are, number one, non-shelter congregate living facilities, such as treatment, behavioral health, and reentry homes. And the reason why we separated shelters is because the agency is managing the shelters through outbreaks and surveillance testing. The second one is what we call high-risk day sites. Frankly, I didn't know day site is a word, but it is a word. And those are mainly areas such as childcare and retail. But retail, we're going to separate as a pilot project. I'll talk about that a little bit later on. The third one is education, exclusive of higher education. And the reason for that is our higher education institutions have been working on with testing for the better part of last year. And they actually have great testing programs for surveillance as well as for outbreaks. And we have learned a lot from them, including with Gonzaga and the NCAA athletics programs. The fourth is testing and technology. And the goal of this particular entity is to remain focused on not only what we're doing now, but what we should be doing for the next 18 months as it pertains to testing modalities and technologies. So we've assembled a group that will focus just on that. The fifth one is testing for variant strains. And although we have not seen either one of the variant strains in Washington, I do know that they have been reported already in Florida, California, New York, and Colorado. And there's 2 of them. One is variant with some specific mutations, which we know as a UK variant, coming mainly from the London area. And there's a second one coming from South Africa. And although they're similar, they don't share the same genetic modifications, and makes them a little bit different. And there are ways of leveraging the current testing to do that. So I have a small group that's going to focus on that rather quickly in the event that we need to worry about it in the near future, which we will have to. So we just want to be ready. And then the last one is institutional corrections. And that is a hybrid because the agency is managing Geiger and Spokane. And by the way, we appreciate the work of the team there at the correctional facilities. We've been in contact with them every few days. We actually just met with them late yesterday afternoon to talk about not only where are we at with managing the outbreak, which is being managed very well, but also where we're going to go with vaccines for correctional staff and inmates. So we do have a plan for that. And as an aside, although it's not part of this conversation, we will facilitate that using, quote unquote, the health officer standing orders. So it'll be under my medical license that they will be able to get their vaccines, which is appropriate, the same way we're managing EMS. So those are the groups. There is one large group that I'm convening separately as a single entity, which is the group that has been identified as marginalized communities. And the reason for that is because that is about half of the total of our task force, and we have some very specific needs in those areas that will need to be addressed with very smaller, very specific groups for each one of those community segments. So the goal of these work groups is to identify the need, assess the need, develop a plan, including justifications for the plan, and if at all possible, we will help with the epidemiological data, but also develop a cost, because it is important to know what are the resources that will be needed. And when I say cost, I'm talking about whether it's staffing, tools, technology, consumables, disposables, so we can determine how much as a community we could do and where is the best place to do it for. We may or may not be able to do everything, but if at least we know what all the needs are, we're more likely to address a lot more than if we're not aware of all the needs. So that's update number 1. Any questions on that particular issue? Commissioner Cooney?
I'm just full of questions today. So I just saw in the news this morning that Providence is now doing a drive-through testing clinic out in the valley. Is Chaz still doing the clinic at the arena and kind of, is that all getting coordinated?
Very good question. Yes, and I was aware of the opening about 2 weeks ago, and the reason for that is it gives us expanded geographical coverage, and it allows Providence to also centralize some of the service for that part of town area, which is already very accessible. Is there ambulatory facility that is down the highway, and that will give us 2 locations. Chaz will continue at the arena. So that now we have 2 big geographical coverage at 2 points, which I think is very, very useful. And we're grateful that Providence was able to put that together. Good question.
Great, thank you.
Yeah, and to end on the testing, because you've heard me talk about testing several times, and this is not a new conversation for either the community or me. And testing is going to become a very important tool as we go into kind of like the second phase of this pandemic, because it's what will allow us to provide surveillance for businesses and other areas that, as we come back, will need to remain open. So that's why we're so intently focused on it. So the next area is education. And education, I had mentioned to the group that we embarked upon a process improvement project on our education consultation and process. And the reason for that is education is a very significant area, is a very important area, and it's an area that we were spending and will have spent significant amount of time. But going forward, we needed to enhance the efficiency of the process. So we completed that, and as on schedule, we presented a draft of what the findings were to our all of our school superintendents and principals, about 63 people, on the 31st of last week, basically. And the goal is, number one, make sure that all of our school leadership gets the same information at the same time. That's number one. Make sure that they get the same consistent information at the same time, and that they have the opportunity to discuss that as a group with us. To maximize the efficiency of access to the agency, we actually have set up office hours for our education team that are set throughout the week. So health nurses, COVID teams from schools, anybody that has questions can participate. And we're doing that in blocks, I think, of 2 hours every other day or something along. It's 2 or 3 times a week. And the reason why we're doing that is because in these large meetings, it's just sometimes hard to address some of the hands-on questions that people have that are more operational in nature. So that was a very welcome change that we've already implemented. Lastly, our goal was to provide our schools with a line of sight for what this year could look like. And I do know that we have some limitations on what we can do, but working within those limitations, we have provided some well laid out criteria on how schools can move forward, because remember, we don't approve their plans. We provide guidance and suggestions on how to meet the requirements and assist them when there are any issues or any concerns. But we were doing that in blocks of 2 or 3 weeks at a time. So what we've done, and the final process will be completed by January the 11th. So we have 3 different milestones. We're about to go into the second milestone this week. January the 11th is the final, because we're gathering feedback from them right now. That will allow the schools to have a roadmap that they can follow. And that roadmap will include perhaps, if all conditions change and are met, et cetera, higher grades going forward too. We wanted to give the schools some tools for planning, some tools for parents to be able to plan. And more importantly, we really are committed to trying to bring safely as many children back to school as we can, because it's very important not only from an academic perspective, but it's very important from a mental health, behavioral, and developmental perspective. And I know you've all seen some of the somewhat concerning rates of mental health issues, particularly in younger people and school-age kids. And I think school is a good place, if we can do it safely, for kids to be not only from an academic perspective, but for many, many, many other reasons. So more to come on that. It was, I think the process was fairly welcome. It gives a lot more structure. It gives a lot more direction. It provides a little bit more ability for the schools to be self-sufficient a little bit. So we don't become a hindrance to the process. So more to come on that. But as I mentioned, it won't be completed until the 11th, and we'll give you what the final is as soon as it's completed. So that's on education, the update that I had. Any questions about that? We're very excited about that, by the way.
I don't have a question, but I do really want to thank Dr. Velasquez and my team here at the Health District, because, I think schools is such a huge thing for the community. And we've been working with schools, for many months, but just really to have that roadmap and that plan that I think it goes along with that feeling of hope of, for parents of we're trying to do all of these things, and we want to be consistent and we want to be equitable in how we roll this out. So, just a big thank you to my team here for really taking that and pushing it forward. So I don't want to detract from questions, but really just wanted to give that shout out. So questions for Dr. Velasquez. Go ahead, Commissioner.
I just want to say thank you, because I've been talking to several superintendents, as this process has gone along, and I know there's been frustration and all of that just on how different districts have handled different things. And I think it's just going to be really great. And so thank you to having a consistent message that's going to be going out to all the school districts, so that way as the others are trying to get back online and catch up to where, need has been, that I think that's, people are very, that's going to be exciting for me and the community to then see it as a consistent message instead of, each school district getting a different message to them. So Frank, thank you very much, and the staff at the Health District.
Thank you, Commissioner. And the last component of that plan is a communication plan that is being developed in conjunction with the schools and our communications officer here, Kelly Hawkins. I don't know if she's on the call. Because we want to make sure that we articulate clearly what we're doing and why and how, so everybody knows, parents, community, superintendents, anybody that needs to know, because we need to have a consistent message, and not all schools may be able to do the same thing at the same time, because there are differences in terms of resources, et cetera, and that is fine. But if the roadmap is the same, at least we all know what the plan is. And then the schools will really execute on those plans according to their capabilities. So I think that's a good way of doing it. And, the agency has a lot of resources in terms of process improvement. And having come from a Six Sigma organization, I'm very much in tune on terms of, there's always a way to improve the process. And we'll continue doing that. So team here did a great job, and in a very short period of time, because we gave ourselves only 2 weeks to do that and to meet our December the 31st deadline, and we did. So anyway, moving on to projects. So a couple of areas that Amelia and Lindy and I are looking into, and I'm doing some of the research right now on the scientific and clinical aspects of it. One is on a project that was mentioned before that has to do with sewage testing for surveillance. And what that basically, if you think about sewage, our systems are built on a grid, so you could isolate effluent from specific geographical areas or even specific buildings, and do viral load testing, basically, which is an early indicator of increasing amounts of virus. That actually has been done in North Sydney, Australia, very successfully around long-term care facilities. So that's a project that I think the agency had been in support of before. We brought that back to the table, and I'm actually looking at the proposal so then I can make some recommendations to Amelia and the team here as to what the viability of that is, because it could help us as an early surveillance system or tool in the future, in the near future. Although I don't want to say it, we do need to make sure that we're ready for whatever the next viral agent is. And this will be one of those things. So that's a project that is in the early stages, but we're going to try to move fast with that. And I appreciate the support of the agency. The second one is we're bringing back the concept of doing a pilot project for surveillance testing on retail, particularly using grocery stores, which are a primary contact for most people. So I was part of that project outside in the community. So we've realigned that and brought that to the agency so we can look at it and see the feasibility for that. And the reason for that is that will give us statistics that will allow us to develop plans that could be applicable to retail environments as opposed to other types of environments. So that's in the area of projects. And I bring those up because we will continue looking at other tools, other avenues, other ideas. And as those come up, we discuss them here internally. And then if it's something that makes sense, we'll look at it. And like I said, I'm looking at the clinical and scientific data so I can make recommendations to Amelia and the team here so we can figure out where to go with it. So I just wanted to tell you that. So we're kind of busy. Trying to do as much as we can, but it is exciting because we have a lot of forward momentum and we're going to capitalize on that. Questions about that or any other issues for me?
There's a question in the chat from Alicia Benson about the timing of the communication plan being shared with parents in the community, and I think that's probably in reference to the schools. And I don't know that we have the date for that yet. Dr. Velasquez, do we have the date?
It will be after the 11th because our commitment to the schools is that we're going to keep everything. And that was one of my requests to all. This needs to be kept like under wraps. I don't want to see it somewhere in the public when it has not been completed. So we all agreed on that. And we have a follow-up this Wednesday. Then we'll come back by the 11th with what the final is. And then after that, you will see communication at the appropriate time beyond the 11th, once we all know exactly what we're doing. Because it is important that our school officials, they all know exactly what we're going to say and who's going to say what. So we're coordinating all of this.
Oh, that's great. No, thank you. I think that's great. I think part of my question too is because on top of all of this, all of our school districts have their levies that'll be on the ballot coming, right here in February. And so the whole issue of the path to being open, perception of reopening, all of that communication. And so this work, I think, and that's where they've gotten a ton of pushback. And so this kind of clarity and shared messaging, I think will really help to lift then some of that. The timing is really important for schools at this moment. And so I think that's excellent work. So thank you.
Thanks, Alicia. Well, schools are important to all of us, so we're on the same page. Any other questions for me? With that, thank you, and I'll disappear at 11:55 quietly. Thank you.
Thank you, Dr. Velasquez. Lindia, on for incident command updates.
Okay, good morning, everyone. I did send out an updated ICS chart this morning, and from your last meeting, you had asked for some more details on it. I wasn't at that meeting, so if I didn't add the right details, just let me know. But I did put the work groups that we're involved in. I added the sectors under the business technical advisors that we are consulting with, and added some of the groups under the case guidance and outbreak management section in the disease response branch. I'm not sure if there was anything else that was wanted, so just let me know if I missed it. And then just a reminder that also the Joint Information System through the Department of Emergency Management is ongoing. And then they are also doing county logistics in connection with our incident command structure. So let me know if there's anything that you'd like added to that. I'm going to have Anne pull up some slides for me, because I know everybody is very interested in the vaccine topic.
It'll be just a moment.
We are getting lots of questions from different groups about where they fit into the phases. And we are keeping kind of a spreadsheet of the different groups that are contacting us. And then we kind of put them in a queue. So hopefully we can use that to help us coordinate when they are able to fit into the phases. I can give you some information on doses. So as Amelia talked about, it's not readily available, so it's a little bit hard to give numbers, but we have received in our county about 4,800 doses of Pfizer, and of Moderna, almost 2,100. So between the two first doses of the two different types, it's close to 26,000 in our county. We also know that the Indian Health Services is directly allocating to like Native Project, and I think they've received like 900 doses themselves. All of the information when somebody is given a vaccine, it's put into the immunization registry. And so I believe that's how the Department of Health is pulling out how much has been administered in a county. And we're going to look into that to see how we can figure out just how many of those doses have been put into somebody's arm. So I just wanted to walk you through a little bit of the vaccine information. So you've probably seen something like this chart. This is the Department of Health's version of the CDC Playbook. And as you know, we're in 1A. And it's a very specific group. It's really high-risk workers in healthcare settings. So high-risk workers is more than just the healthcare providers, nurses, ARNPs, doctors. It's also those that take care of patients that maybe just maintenance or laboratorians or anybody that has to have contact with an individual with COVID. And then high-risk first responders really is defined as the emergency management system, the EMTs, the fire, and those that have maybe contact with somebody in an ambulance in picking somebody up. Next slide. So the message here is that the Department of Health is really wanting us to stay strict around the phase 1A focus. And in the italicized, they really talk about that that's where they expect this vaccine to be going. The other population is the congregate living centers with nursing homes, assisted living facilities, and others. And that's going through a different route than the healthcare systems. So we're really trying to focus the vaccine in these areas. And I know it's difficult for people because everybody is getting very excited about the vaccine and they're really wanting their sector to be able to be vaccinated. But we really are trying to stay true to this 1A group. Next slide. So this spells it out even more. And then in the healthcare setting, they even have a more defined version of this that helps them prioritize within the healthcare system. So it's really detailed. And after this group gets pretty fully vaccinated, then they'll move on to the next phase. Next slide. So they're really using these principles. How do we use the vaccine to the most maximum benefit, equal concern, mitigation of health inequities, fairness, transparency, and having it evidence-based, and then really focusing on risk. Where is the risk at? And that's why it's really focused on healthcare systems, congregate living systems, and those type of places. So you can take the slides down, Anne, thanks. Through our emergency management system, you've been hearing probably on the news that we've been holding some clinics, and they did give around 230 vaccines yesterday and have about 150 more scheduled for today, and they'll just keep doing that. So what's very cool about this project is this is the first time we've been able to use EMTs to vaccinate. And this was an emergency declaration that would allow us to do this. So over the next 2 weeks, we're really in a training ground with our EMTs to make sure that they're comfortable giving vaccines and doing it properly. And then they'll all be out in the 15 fire stations and set up so that we can vaccinate additional people through the different phases. So it's really equally distributing it throughout our county and getting it set up as a venue for people to get their vaccines. We have sent some of our staff over to the EMS clinic that fall into the 1A group, and they have been getting those vaccines throughout this week. So I'll stop there for a minute to see if there's any questions around vaccine.
Hey, Linda, before we just open it straight up for questions, could you go over the numbers again? I saw everybody kind of writing those, I think, as you were saying them, and you listed the number of Pfizer and Moderna. So if you could just repeat those.
Okay, so Pfizer, it's basically gone to the Providence system at Sacred Heart, 4,875 first doses. They've also received 3,900 for the second dose, and I didn't give that the first time. Moderna has been spread out through the healthcare system to a variety of clinics, and we have received 21,100 doses. So that's a total of 25,975 first doses in our community. We have a long ways to go. That is just a little tiny piece of the pie. So hopefully we're going to keep getting shipments. And I did notice that Moderna is trying to really expand their manufacturing and get us even more in the nation. So I did want to just remind people that all of our testing information and vaccine information is on our website, and we are really committed to try to keep it current and have the latest information on there. We just revamped it, so hopefully it's a little bit more user-friendly. And then my last thing that I want to talk about is we are getting lots of public requests for information. And they're coming from all over, but they are coming from elected officials also. And I'm not sure if your organizations are also getting some. I know that when we were out at the EOC, there was duplicate requests going to city and county and us. And just wondering if there's some way to coordinate, consolidate, as you know, they take a lot of time, and they just keep coming. So I don't know if you have any thoughts on that either. That's it for me. So questions, feedback on the public requests? Doug?
Yay, thank you. Lindia, what is happening with the doses that go unused? So somebody gets a certain allocation, half the people want them, half the people don't. What are you doing with the doses that are quote unquote left over?
We try to not let that happen. So a lot of the scheduling is the way to do that, so that you know exactly what you're going to be given, so you don't have wasted and unused vaccine. So it's really in the administration of how you logistically set that up.
And Doug, oh, sorry.
Just a question on the EMS staff. So you said 15 different fire stations throughout the community. Was that volunteers from EMS, or are you trying to do strategic? I mean, just thinking of the number of fire stations, I think there's probably 15 fire stations in Spokane or 15 fire stations in Spokane Valley. Just kind of wondering where that came up.
Yeah. So Mike Lopez from the fire department is the one that's coordinating that. And so I believe he picked them logistically throughout the county so that it's all equitably distributed.
Is that just a pilot then and it'll eventually expand, you're thinking? Or is that just...
No, I think with the staffing, that 15 is about all that we can run. And, you know, if they're putting through 200 to 300 a day at 15 different sites, that's a pretty good effort.
Okay, thanks.
Also, I think next week I can bring you all the different venues that we are talking about doing in getting the vaccine out, along with the number of vaccine providers that have enrolled to give COVID. So you can just see all the different ways that people can get vaccinated. Shirley?
Hi, in the state's phase 1A, there are 2 tiers, tier 1 and tier 2. Who notifies the people who are the healthcare workers who are in tier 2 that it's now their turn? And for example, mental health workers who go to people's homes, when will they be told they can now go get the vaccine and where to go?
Yeah, it's all through the, excuse me, the healthcare provider system that we have been just messaging out. So that's part of our line list that we're keeping, our spreadsheet that we're keeping. Frontier Behavioral Health contacts us, so we put together a spreadsheet with them. We'll call them back when we get to that phase. So it's just a kind of a communication cascade.
Okay, so do we notify you then that we want to get on the list?
You can, yeah.
Okay, thank you.
And I just want to go back. Oh, I'm sorry, Shirley. I thought maybe you had another question. You know, on Doug's question about what happens, you know, with leftover vaccine. And I just want to kind of clarify, once there are, and maybe Linda, you can talk about this some more, you know, there are providers in the community that are authorized, that are bringing the vaccine in, and it's not, so it's on each of those providers to maximize their use and to ensure, you know, safety of the vaccine so they don't have to waste it. But that's something that's kind of beyond the health district. Just to kind of clarify that, is that once those providers have that vaccine and it goes into their custody, it's not like we're not going back around to them. You know, I mean, that's just kind of beyond what we do. So I just want to make sure, you know, it's the providers that would specifically be giving out the vaccine versus the health district, you know, going into each of those places. So just kind of wanted to clarify how that works.
Is there a way for us to get a copy, or get a list of who got the vaccine so we could approach them?
So we do have some venues that are, we call them open pods. So they're not just vaccinating their staff, but they're vaccinating other groups also. And they're the ones that are communicating out. So if you go onto our website and go into the vaccine section, a lot of these questions are answered there. And if you don't find your answer, let me know.
Thank you.
But it really is the responsibility of those open pods to communicate out. And Multicare and Providence have been great about also opening it up to those outside of their system. So they are considered open pods.
Yeah, so for example, Providence sent out communication because they've also used some of their vaccine to immunize EMS workers. So I think all of the systems are trying to do everything they can to maximize the number of doses within the phase that we're currently in, because, it's kind of like a matrix, of trying to figure out, you've got to have the vaccine. It's got to be, one of the providers, and the individuals need to fit into that first phase category. So it's not just a simple, these are the folks that can get it. It's kind of got to tick all those different boxes. Other vaccine. Oh, go ahead, Doug.
And Amelia, I think that's why Mayor Mikey and I were asking the question, is because government employees aren't really on the list anywhere. If, let's say, Eastern State Hospital is doing a mass vaccination, yet they're not using all their vaccine, does it have to be, can other groups get vaccinated, or do they have to be in 1A? And you were saying that it's up to the provider, but then you're saying it has to tick all these boxes. So I assume.
Yeah, the provider should still just be doing it in those phases. I guess that's the point I'm trying to.
Okay.
Right. So Providence they shouldn't. And I don't want to just, any hospital system that has it right now, they should still be focusing on that first phase. So if they had extra, they would need to look in that first phase and say, okay, EMS, and those different groups. I think Kelly just put in the chat that DOH is working on a vaccine finder tool. That will be available to the general public.
And there is the ability for systems to transfer the vaccine to others who may need it and could get it out. So they are doing that within the different agencies. Okay, thank you.
All right.
Amelia?
Yeah.
Yeah, this is Commissioner Kearns. I was wondering, I couldn't find it on the Health District website, and I don't know if we have one yet, but I saw Idaho had released a very, very easy to understand kind of graphic that kind of laid out sort of month by month how they predict those phases of who would receive the vaccine. I'm pretty sure, with the supply chain, I'm sure that's kind of wishful thinking. But has the Health District made anything like that? Just so when people call and say, here's my circumstances, here's where I'm at, when would I be able to get the vaccine? We would maybe be able to direct them to kind of an easy to understand graphic to where they can kind of look at a chart and see kind of at least best case scenario or best guess when they would be able to receive the vaccine. Because I've had several folks reach out and say, I own this business. I'd like to get my staff vaccinated when. And it's a hard question to answer without the information. Is there a tool or an easy to understand way or a graphic that we could direct them to give them some sort of an idea?
Yeah, we do not have kind of a timeline because it is so much based on when we're getting the vaccine. We are putting together our own local playbook that will show the different venues of how we're getting it out. And I can share that when it's more finalized. But it is a guessing game, and so we have not done that. Predictions are we'll be moving to the next tier within the phase, like in a couple of weeks. So, I think just rolling time every other week will probably be, bumping out. So it's difficult.
And I think that DOH site, and going off also what Sarah just put in the chat, is that I think once the DOH site is live related to vaccine, people can plug in their information and that should give them an estimate.
So I understood it was more about whether you are qualified for the current phase, not the future phase. So like the tool that you have right now, you put in your information, I've played with it, and it will say, nope, you're not eligible for this phase. So I don't think it's a prediction of when you'll get the future or when, time frame.
Okay, yeah, and I think Commissioner Kearns, to your point, and kind of why I was trying to clarify on the extra doses, is that, nothing through this response has been simple. And, it's been very hard to figure out how to communicate everything. I think we would all love to have an infographic because, anything we could do to make it simpler would be great. But I'm not sure. We could look at maybe the Idaho one to see what they've done and see if it's something we could maybe recreate. I'm not sure how they are doing that with not knowing the supply of how it's going to come down, because I know even within the state, that number here changes, right, based on the supply of the vaccine. So yeah, interesting. But I definitely, I think it's a good point that we could try to look at a simple communication.
We do have a simple little kind of checklist of, are you this, or this? Yes, you qualify for the 1A or that type of thing. But that's all we have right now for that.
I think you're going to probably struggle with anything you try and come up with because it's so generic. You know what I mean? It's like you're saying, if you fall into 1A or if you qualify, if you're this, and this, well, there's probably 100 groups that are saying, am I this? I could be this. So, I don't know how specific you're going to get it other than just be available to answer questions. I think what you're doing is good. There's just so many little niggling categories that can fit. And I think that's what probably people are asking you questions on, who fits into what. It would be nice if we were all labeled certain things, but you're going to end up with a spreadsheet the size of I don't know what. So I'm not sure if you're going to be able to whittle it down like that.
And then I had one more question. Lindia, you referenced there had been several public records requests. Is there one common item that seems to be the front runner on what it is people are looking for? Or is it pretty much a mixed bag of everything under the sun? What's sort of the look of these PRRs?
Yeah, so I think that's one of the difficult things is they ask for like all your cases. And so then we try to get them to really like narrow it down, or what are you really looking for? And so that's kind of the back and forth that we're ending up doing with people, is to really understand what their request is about. Everything COVID. So it's really difficult.
Yeah, we've had a lot of requests for contact tracing information, details on cases. And then I know we've had a couple that have just really been anything that has the word COVID or coronavirus from January 1st through, December 31st or December 1st or November 30th, and if you think about, even just think about our meetings, right? We meet weekly, and how many times we use the word COVID in all of our materials, or, and I think, we're trying to do a good job with people calling in and requesting those because it's unclear, we don't know, what they're trying to figure out, and we can't necessarily push on that. But it takes a lot of time because, there are some things that are protected related to individuals in HIPAA. So then we have to go through and redact a lot of information and create the redaction log. So I know, especially when it comes to electeds, we've been trying to have follow-up conversations to try to help them maybe tailor the request a little more so that we can try to get them the information that they need or that they're looking for. But it's something, we have so many of them, and it's something that I think every health district is struggling with. But, I think if there's just any ways or ideas that any of you have as elected officials on how we communicate that or how we kind of do follow-ups to try to narrow it down, I don't know. But yeah.
Lean on your attorneys, because you don't have to create new records, and I'm not going to tell you how, but I would say, I know it's expensive, but lean on your attorneys. That's what I think we all do, because they're the ones who really will narrow it down per RCW, et cetera. So, I understand what you're saying. That would be just a mess to come up with every document with that word in it, but you don't have to necessarily create new documents to fulfill public records requests. So I know it's expensive, but lean on your attorneys would be my suggestion.
For sure. And we keep her on speed dial as it is. All right. If there are no other questions or thoughts for Lindia, I think we can open it up for Alicia for GSI.
Thanks, Amelia. Good morning, everybody. Not too many major updates. I think the biggest thing, and I'd be interested kind of in this group's response, we're awaiting the governor's announcement on their new reopening plan. A lot of, there's lots of potential details, what it may look like, but I think it will be important that this group is able to kind of, come together on that and make sure that we have some coordinated response should we, depending on what it looks like, what our thoughts are around it, those kinds of things. And so that's a big piece on the kind of the top of my mind. And then the other piece just on the back end is with the new federal dollars. There's a lot of work going on with our state partners, with the Washington Economic Development Association, Commerce, and others around particularly outreach to small businesses and nonprofits in rural and underserved communities around accessing PPP dollars as they open that. And so ensuring that we're able to get those businesses and nonprofits who are most impacted or have barriers to be able to access those resources connected to that as they open up the next round of PPP. So a lot of work kind of on the back end around that, around the entire, not just locally, but across the state, as far as how the network will be able to activate quickly to support businesses and nonprofits. And so those are the two of the big things that kind of front of mind for this group, and welcome ideas, and look forward to being able to have a conversation once we have a better insight onto what the new reopening plan looks like from the governor's office, I think today. Happy to answer questions if people have them or anything that they're hearing.
Thanks, Alicia. Any questions for GSI? All right. Thank you. So the next thing up, I just wanted to give an update. I'd mentioned in our last meeting that we've been having ongoing conversations with the hospitals related to surge and capacity. And just to give you all a heads up, later today, there is going to be a press conference with the hospitals where they're going to be requesting, so here in Washington, we have a medical reserve corps of retired medical professionals who are still, willing to practice or to jump in when there are emergencies like public health emergencies. And so the hospitals are actually going to be requesting that anyone who's not signed up for the medical reserve corps get signed up for it. And they're all looking, so Providence and Multicare are each looking at how they could increase bed capacity by having medical reserve corps that they could work with within their hospitals. So just so you all know that is going to be announced later today. If you remember back to the spring, the Medical Reserve Corps was actually really helpful here at the Health District by hopping in and answering calls for medical providers so that physicians could call in and talk to other physicians, or nurses could call in and talk to other nurses about the latest data and latest information on the coronavirus, which was constantly changing back in the spring. So just wanted you all to have a heads up on that, and also that we're still continuing those conversations tomorrow. Dr. Velasquez and Lindy and I will all be meeting with the hospitals again to do some tabletop exercises and to make sure that they all feel prepared. I think everyone is trying to figure out, what, if any, kind of surge we will have, given, we tend to see it in that 2-week range after holidays. So potentially mid-January, we want to make sure that we are prepared in every way here in the county. So I don't have anything beyond that. If there are general questions or comments or things that we need to add to the agenda for next week. Oh, Doug. Yeah.
Sorry. Hey, Alicia. So here's my question. The governor comes out and let's say things open up again. Okay, restaurants, bars, whatever. What's going to be different this time? This is opening number 3. And, to me, I think the messaging needs to switch, and it needs to be on, fair or not, it needs to be on restaurants that, they control their own fate on whether they stay open by enforcing what they need to enforce. We've seen the Black Diamond in the Valley say they're staying open and all these things, but what is going to be different this time if restaurants and bars and businesses are opened up again? Is it the messaging? Do we switch the messaging to we're all responsible for keeping these businesses open by, doing the things we need to do, or what? What's going to keep them open this time?
I think it's a great question, Doug. And I've kind of heard some different spatterings about what the new plan is going to look like. My understanding is that it's kind of taking somewhat of a different approach to some things. What we haven't seen yet is what that means for the sector specific, and will that change the phased reopening, who's closed, who's not closed, those kinds of things. And so, and that your question's a little bit to my first question is, I think depending on what the new, this new approach for this period of time, now that we have vaccines rolling out and those kinds of things, what is that shared messaging? What should it look like? How are we lifting up some of those different sectors? I think that to me is the conversation. Is it an opportunity for us to work towards some collective messaging around the economic recovery, along with the continued needing to stay stay focused, because the realities of the healthcare surge and impacts on the healthcare system and those kind of things are very real right now. And so what is that dual message? And is there an opportunity for our region to stay, to really come forward in a kind of shared message around it? I think those are the types of questions, Doug, that I have. And your question is one of those ones that rumbles in my head too. But to me, we don't have enough details yet on what it is. And so the opportunity to then come back together to think, to be collective in that response.
Yeah, and I think, the state gave, they asked for, so that's Dr. Velasquez, the call that he is on right now is to hear some of that information. And, I think we'll need to come back to this group with some of, to address those questions of what does it look like going forward, what are the phases going to look like? How will it be monitored? How do we get any of it out there? So, yeah, I think to both of your points, we'll need to have a discussion with this group to kind of talk about what that messaging looks like.
And I'm like you, Doug, curious what is different or not different. Does it make any changes to the industry pieces? And we have specific sectors like the restaurants who are most impacted. And if I look at even the current path, their path to reopening is still a ways away. And so what does that look like? What does that mean? Same for our gyms and those two sectors particularly.
Any other questions, comments, concerns before we adjourn? All right, not seeing anyone raise a hand or anything. So I think let's go ahead and plan next week, same time. And I know Steve Smith won't be here, but someone from his team will present the data to everyone. So if there isn't anything else, I'll see everyone next week at 8 a.m. Thank you. Bye-bye.